Nikawauliza, je, tangia wakati alijifungua usiku hakuna mtu amejitoa amsafishe? Naona ako na damu kila mahali. Waliniambia wakati pressure itateremka ataenda akanjioshe.
Ili stick to kwa mtoto wangu wa kwanza. Nasema sasa ningekuwa na yeye.
In what should be the safest space where new life blossoms and joy fills the air, a dark reality often lurks unseen. When those you trust to make your maternal care smooth betray you, behind closed doors, a silent epidemic persists. It is a story of pain, anguish, disappointment, and dreams turned into nightmares. This is not just a feature story. It is a reality. A revelation of OBV, obstetric violence. Obstetric violence, or OBV, is a form of violence meted on women during maternal care. It could be physical or psychological. Unfortunately, it is evident that not much attention has been given to this form of gender-based violence. Most women don't even realize their rights are being violated in medical institutions, as this has become normalized. According to a 2019 study by the World Health Organization, more than 1/3 of women in 4 lower-income countries experienced mistreatment during childbirth in health facilities. Younger and less educated women were found to be most at risk of physical or verbal abuse, stigma, or discrimination. A recent survey conducted by Nguvu Collective in Kenya revealed that 83% of women across the country have suffered OBV during childbirth. 5 strong and bold women have come out to expose these animals nurtured in healthcare facilities. They have come out to share what they went through, narrating near-death experiences as a result of OBV.
Kwa majina ni Ngina Usioki. Niko na familia, watoto 3 na baba pia ako, wasichana 2 na kijana mmoja. Nikiwa na mimba ya second born, nilianza kubleed mimba ikiwa 8 months. Nikaenda private, ilikuwa jirani, wakanipea referral, wakaniambia niende kwa referral hospitali ya public. Nikaenda, kufika huko kwa public sikuwelkamiwa vizuri. Nilifika kwanza na nilikuwa bado nina bleed na mimba ilikuwa 8 months. Nikakaa almost 1 hour, ndio wakaniambia niende huko nje niskaniwe nijue mbona nina bleed, of which nilianza kubleed mimba ikiwa 8 months. Nikaanza kubleed, nikaenda kwa private, ndio ilikuwa karibu, wakanirifa, wakaniambia waezi nisaidia niende kwa hospitali public ambapo ni Pumwani. Kufika huko kwanza nilichukuliwa, but hawakuniatendia immediately. Wakanikalisha kwa kiti almost 1 hour. Kulikuwa na student ndio walikuwa, daktari alikuwa na manas, alafu kulikuwa students. Student mmoja akasema tunaweza mshughulikia, akasema mchukueni huyo, emergency hapa ni mingi, hiyo yake si emergency. Huyo student akasema, akaongea na wenzake, wakaniuliza kama niko na pesa niende niskaniwe nje ya hospitali. Nikawaambia pesa itakuja. Cause nilianza kubleed, nikaenda bila kuarifu mtu, sikubeba anything, nilishtuka. Saa mimi nikaenda hapo scanning, nikapiga simu, nikatimuwa pesa, nikaskaniwa, nikarudi. Nilianza kubleed saa 4. Nikaenda Pumwani, nilifika by 1. Imefika 4:30, nimeskaniwa, nimerudisha results, sijashughulikiwa. Wakakuja nikawapatia results. Wakaniambia panda juu ya kitanda. Results zinaonyeshana njia imefunguka. Immediately kupimwa njia, maji ka break. Maji ku break, bado niko kwa hiyo kitanda ya reception. Kufunguliwa kupimwa njia, maji ilikuwa isha break. Daktari akaniacha, akatoka akaenda. Daktari by the time anarudi, alirudishwa na mlio ya mtoto. Mtoto alikuwa shatoka. Nimekuwa mama yangu amekuwa kishikilia watu wanazalisha, so nilikuwa najua vile naweza lock placenta hii umbilical cord. So vile mtoto alitoka alilia, nikachukua ile umbilical cord nikaikunjia kwa kidole, nikaifinya na kucha. Nikaekelea mtoto hapa kwa kifua. Niko bado kwa waiting hapo kwa waiting yao hapo reception kwa hiyo kitanda. Daktari akasikia mtoto amelia. Akakuja mbio, hakuwa ameshika kitu. Akapata nimeshika. Placenta ishatoka, mtoto wako hapa. So mimi ndio nimeshika hivi umbilical cord. Akakuja akaniambia, msichana umejaribu, congrats.
I'm a mother of one. My boy is 7 years now. And my journey, I can say my pregnancy journey it was smooth until the time that came for me to deliver. That's where I faced some discrimination and challenges because I went to visit different hospitals before I was finally accepted, just because of my condition. And I remember this second hospital which I went to, I was with my mom then. And when I reached there was this female nurse. I don't know if
So you went to 3 different hospitals before you were treated?
Yes.
So had you gotten to that point of labor?
Of course, I was already in labor, remember?
You were already in labor?
Yes, because the labor got me at home. Mm-hmm. It was around 9 p.m. And by the time that I was being admitted, it was the following day at 12 a.m. You can imagine that period. So it was not easy. So the first hospital we went, they rejected the second one also. So at this second hospital, we found this female nurse. She didn't even give me a chance to express what I want. Obviously, it was obvious that I was in labor because the water had a little broken, so you could tell that this is a woman who's in labor. But upon seeing me, I remember her words very well. She told us that we don't treat such a people, we don't handle such a people, meaning she can't handle me. It's like, to me, that's form of a discrimination, because if it was a woman who had no disability, of course she could have been taken in. But for me, because I had a disability, now she said that they don't handle such a people. So we had to look for an alternative, because you see that...
Did they give you a reason, or did they just throw you away?
They just, I didn't even have to get to the labor wards or wherever. She just told me and said that we don't handle such a people. So even if you wait for a time there, you are the one who is in pain, you are the one who is understanding how you are feeling. So we had to go after she said that. So we went to the other hospital, whereby I was well received, and I was given a private wing where I stayed with my mom until my discharge time came.
Niliweza kutembelea rafiki yangu katika zahanati moja. Ile dhuluma nayo niliona mimi kama rafiki yake kumtembelea. Niliweza kupata jinsi alivyojifungua. Mwili yote imekolea damu. Hakuna aliyemsafisha. Amewekewa catheter. Catheter imejaa mkojo. The time niliita na sijui alikuwa nurse ama alikuwa daktari. but ni mhudumu kwa hiyo hospitali. Nikamwambia simsaidie huyu mama, hii catheter imejaa. Alinijibu akaniambia enda utoe umwage kwa besheni. Ile hali mimi vitu kama hizo sijainguza na sijui. Nikawauliza, je, tangia wakati alijifungua usiku hakuna mtu amejitoa amsafishe? Naona ako na damu kila mahali. Waliniambia wakati pressure itateremka ataenda akanjioshe. Ile hali na although hata hiyo usiku walikuwa wamemchapa. Walimchapa sana mpaka huku magodi ikawa hawezi tembea. Kichapo cha mama na yuko na blood pressure, wakamwacha pale, ndiposa ajifungua walikuja kumpata chini ya shafendi.
Some of the women who've experienced this form of abuse have had it even worse. Family that is supposed to provide support, love, and care turned out to be the devil in Bella's story. Her partner abused her when she lost her son due to neglect from healthcare practitioners.
I remember vile nilijifungua mtoto niko naye. My husband alikuwa ananimistreat kwa nyumba, anunui hata food. But a certain lady akakamu kwa hao. Wadi yenye alitumia. Imagine anaongelesha my husband. Anamwambia sana nataka urudi ukuja na begu ya mwanaume. Tumechoka kuona wasichana. So by that time ili stick to kwa mtoto wangu wa kwanza. Nasema sasa ningekuwa na yeye. Sasa yangekuwa 10 years. Onge inaniuma sana nikikumbuka.
To understand what goes on in hospitals leading to obstetric violence, we talked to Deborah Munari, a nurse in one of the most reputable hospitals in Kenya. She gave us the perspective of nurses and doctors as far as OBV is concerned in the hospital setting.
My name is Deborah Munari. I'm a change leader with Nguvu Collective. I'm a nurse at a public hospital within Nairobi County. I'm also a patient's rights advocate and an advocate for social justice in general. Obstetric violence is a form of abuse that occurs in hospitals towards pregnant women during delivery and during the postpartum period. And it can occur in different forms. According to the recent research conducted by Nguvu Collective across 27 counties in Kenya, the most rampant form of obstetric violence reported by the women was verbal abuse, which came top. Also, we saw physical violence. Some women reported being slapped, restrained against their will. We saw non-consensual pelvic exams, whereby women were subjected to these exams forcefully without being explained to or, asked if they would consent to that. So some didn't even know it was necessary. Some thought they were being abused sexually. We also saw many different forms of violence, being neglected, disregard for pain. So yeah, it's a wide range.
Okay, so most of the women that we've interviewed so far, literally all of them have mentioned that it's the nurses that harass them, especially when they're going to give birth. Why do you think that happens? You as a nurse, what do you have to say about that?
Okay, first of all, according to your question, our survey was done in 189 women, and about 60%, 59%, we saw nurses being the perpetrators. But we also have doctors and obstetricians. We have other members of the healthcare team, even support staff like cleaners. We saw some, doing this violence against women. So it's not limited to one specific type of healthcare provider. But we can see that the majority is nurses, because I believe nurses interact more with women in the maternity room. And as to why nurses would do this, or healthcare providers in general would do this, of course there's no correct answer 100%, but I would talk on my perspective. We have no accountability. or it's low rather. So there's that culture of handling people the way you wish to, the way you want, and you think nothing would be done against you, basically. And we've normalized this so much in our hospitals that women themselves don't know that it's wrong for them to be insulted, it's wrong for them to be abused. So they're not speaking up for themselves, they're not reporting. They go in the labor room expecting that kind of treatment, basically. So it's an enabled culture. There's also the issue of some nurses, they're overworked, they're in stressful environments, short-staffed. So all this can, lead to compassion fatigue, whereby they're basically unable to feel empathy for these women, and they resort to treating them harshly. There's also the form of that, power dynamics in hospital, whereby you feel, I'm the more educated person between the two of us, which is not always true in hospital. Every sort of individual goes there. But there's that mentality that you're on a higher rank since, you're here, as a nurse and I see a patient, they're the ones that need me more. So I feel like I can treat them however I really wish to. And when it comes to obstetric violence against disabled or people with disabilities, there's also that aspect of, some healthcare providers may not be knowledgeable on how to treat some types of disabilities. So basically they might end up being disrespectful just because perhaps they're ignorant on how to handle these people. Yeah, that's what I would say.
So, have you gotten into a situation where you feel, because you've mentioned something to do with compassion fatigue. Yeah. Have you been in that position as a nurse at work? Have you been in that position?
Okay, so that term is, it sounds complicated or complex, but the way I understand it, yeah, I've felt like that before. Sometimes you feel you're overwhelmed. There's so much work and you're being called left, right, and center. You don't know, you're not able to give 100% of what you would usually give, but that still doesn't give you the right to violate people's rights. Once you realize that, I'm getting tired, I'm getting stressed, then you reflect upon it, you're able to just try and be professional, and then you can go sort your stress later back at home. So it cannot be an excuse that just because I'm overwhelmed, I should now physically abuse someone, for instance, or verbally abuse them. Sometimes we can let some things slide, but, when you're one nurse taking care of 50 people, maybe you're not able to talk to them at the same time and handle their issues, but you can always express yourself in a more decent manner rather than resorting to verbal abuse.
OBV being one of the forms of gender-based violence rarely talked about, Nguvu Collective, an organization that brings together women change leaders across various countries, took it upon themselves to expose the ills in maternal healthcare and tell the stories of some of these women.
I would say I would like to pass on a message to all the women out there, those who have been through childbirth, those who are currently in the pregnancy period, and even just women in general who have sisters and mothers and friends who have been through pregnancy or currently pregnant, and even our decision makers, CSOs out there and organizations and activists. My message to them would be for us to rally together and also ensure that we do our best to give visibility to obstetric violence, because it's a form of silent gender-based violence that has been happening in our healthcare system for a really, really long time. And the impacts and implications of it on maternal, infant, and child health are significant. I mean, just through the survey already, we were able to see many women reporting that about 17 children ended up dying just through obstetric violence. And then there was also a significant number of children that ended up having a disability because of the kind of form of obstetric violence that they experienced during childbirth. So it's very important for us to ensure that we rally together and we work together collaboratively to create more awareness and educate our communities, ourselves within organizations, and capacity build one another on the issue so that we can be able to tackle it together. And then lastly, since OBV, obstetric violence, is a form of gender-based violence, I would also urge everyone out there, including decision makers, if there's a way for us to also ensure that we give OBV equal visibility to the others as well, and categorize them together so that whenever we are talking about them, thinking about solutions, we don't forget obstetric violence as well, since it's happening in the hospitals and it is having an impact on our women and infants and children.